Our message is simple. There are early symptoms of a heart attack that you can recognize hours, even weeks, before a heart attack occurs. Early detection is vital to prevent severe damage to your heart or even death. It's important to recognize the signs of a heart attack and respond by seeking help immediately. Early heart attack care consists of two parts: recognition and response. Recognize the subtle early warning signs. Whenever there is chest discomfort or pressure, become aware. Is the discomfort reoccurring? Does it originate in the center of the chest? Does it subside while resting and reoccur when active? The response to the symptoms must be decisive. Seek medical attention immediately. Early signs of a blockage may occur hours, even weeks before an acute heart attack. To save lives, we must recognize and respond. We've learned that CPR saves lives by intervening when there is an acute heart attack. When the heart stops, we can shock it back into action, but the heart damage has already occurred, and sometimes death cannot be averted. Doesn't it make more sense to check out the mild chest discomfort before complete blockage takes place, resulting in heart damage? We can stop the progression of a heart attack if we are alert to the early signs. Why is this necessary? 85% of the damage takes place in the first 2 hours of a heart attack. If the message of early recognition and response penetrates the country, it may be the force that topples the heart disease as the #1 killer. Heart attacks have beginnings. Become educated to recognize the warning signs: mild chest pain, pressure, or discomfort, reoccurring pain or discomfort in the chest that occurs with activity and subsides while at rest, shortness of breath, a burning feeling in the throat and chin that can be confused with heartburn or indigestion. We need to respond immediately to prevent heart damage and avoid sudden death. Your action can save lives. Whether you are experiencing the early symptoms yourself or you are a witness to someone else experiencing early symptoms of a heart attack, you can become an early cardiac caregiver by insisting on medical attention. The more ways we reach people, the better chance we have of stopping heart attacks as the #1 killer of adults in the United States. The message is simple. Share the message to recognize the symptoms and act immediately. Health courses in high schools, community college can teach early warning signs and responses. Paramedics, firefighters, police officers, educators, physical fitness instructors, the general public, and you may be the first responders to someone experiencing the early signs of a heart attack. Your action can save a life. There are actually 3 presentations of heart attacks, and if you are the first person on the scene, you are called the first responder. The first responder is the Good Samaritan who performs CPR, calls 911, or convinces the victim to get medical help as soon as possible. The first kind of heart attack stops you in your tracks. This is called the CPR scene. In the first type of heart attack, we need to know cardiopulmonary resuscitation or CPR and perform it well. The second type of heart attack is where damage is already taking place. The patient is experiencing the elephant sitting on his chest. Call 911 and behave as an executive spouse because the patient usually does not put up much of a fuss and is in severe pain and is very weak. The third type of heart attack is just in the beginning, and the early heart attack care provides a beneficial impact. This is the most difficult time to get someone to seek medical care. The victim will normally complain, but then use excuses such as food poisoning or gas. The patient has minimal symptoms but is in extreme denial. The patient to first responder interaction can be frustrating. The patient may be embarrassed and wants to ignore it. At this point, they can convince the first responder to contribute to the denial. Even paramedics can find it difficult to convince a conscious patient to go to the hospital. This is the reason why the heart attack remains the #1 killer in the adult population. Several hours here can make the difference between a pleasurable and enjoyable life versus cardiac impairment or even death. Be alert, be active, be heart smart, be an early heart attack care provider. Heart attacks have beginnings. Symptoms can begin about 2 weeks prior to a major cardiac event. This is the window of opportunity to prevent death and minimize heart damage. Heart attack deaths kill 800,000 people per year in the United States, but we can cut that number by 50% if people will learn the signs and symptoms of early heart attack care. Signs and symptoms include nausea, pain that travels down one or both arms, jaw pain, fatigue, anxiety, chest pressure, squeezing or tightness, back pain, shortness of breath, or a feeling of fullness. If you suspect someone is having a heart attack, be a good Samaritan and get them to medical care as soon as possible.